Hello. Welcome everybody to Revive Health's daily briefing live for Thursday, April 30th, 2020. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators who are dealing with the COVID-19 crisis. I'm Chris Bevelo, Health Systems Practice Lead at Revive Health, and your host for the show. I am joined by Chase Kleckner, who is Senior Marketing Manager at Revive Health, and our show's producer. Hello, Chase.
Hey, Chris, good to see you.
Good to see you too, sir. We are also welcomed by, we're not welcomed by, well, maybe we are welcomed by. Are we welcomed by you, Chris Wickline?
Absolutely.
Thank you. We appreciate that. We are joined by Chris Wickline, who is part of our strategy group here at Revive. Chris consults with our health system clients on branding, marketing, communications programs. In her past life, she led a team of integrated marketers at Health Grades, working with systems across the country to develop consumer acquisition, engagement, and retention programs. She started her career in healthcare on the payer side, leading e-commerce, lead generation, and retention marketing functions for an individual health insurance business. Officially, hello, Chris, welcome.
Thank you very much. Glad to be here with you, Chris and Chase.
Yes, thanks so much for joining. Looking forward to digging in a little bit. As with each show, we're going to cover the latest news on COVID-19, also provide some resources and share what we're seeing and hearing from across the industry. We want to have this be an interactive session as much as possible. So if you have questions for Chris or myself or Chase, please use the Q&A function tool Q at the bottom of the Zoom window. At any time during the podcast, just put your question in there for us. You can also use the chat function for Zoom if you want to talk to other attendees, and Chase will be using that to post some links as we move through the session. But if you'd like us to answer a question, make sure you use the Q&A queue to do that. Remember, you can subscribe to the podcast on iTunes. Just search for Revive Health Daily Briefing Live. We will also be posting a recording of this episode as we do every day by later this afternoon. Visit our website at thinkrevivehealth.com/COVID-19. You will also find other content there related to COVID-19, which we'll talk about in a little bit. A couple of last kind of housekeeping notes before we move into the content for today. We're not experts on COVID-19, so not a place to come for medical or scientific advice or resources, but we do have opinions on how marketers and communicators might want to manage this crisis. But as with everything, it is important that you keep in mind your specific situation, your organization, your market, because obviously everybody is dealing with this differently depending on how COVID-19 is impacting them. So have that filter on when you hear us talk. So the first thing we like to do is jump into the news. And we always start with the news in terms of case count. We want to do that just to kind of keep an overall context as we talk about the different things we're seeing. And as we move through this crisis, hopefully starting down the other side, at least in terms of a country, that's going to change what we talk about and how we talk about the crisis overall. So we use the Johns Hopkins tool, though I think also the New York Times has a lot of great data and charts to use. I'll reference that here in a second. But when we look at Johns Hopkins globally, they show 3,231,701 confirmed cases of COVID-19 with 229,447 deaths. When we look at the United States, we're at 1,046,022 cases, and we are now beyond the 60,000 mark at 61,288 deaths. The context that I think the New York Times gives, and we can probably find here as well if we dug a little deeper, is they have a nice chart that shows the daily death count in the United States, which basically has been going up. There was a huge spike in the middle of April when New York City attributed a number of cases that weren't confirmed as COVID, but they believe were related to COVID in terms of deaths. And then it kind of came back to where it was before, and it was going up, and then it dropped for a couple days earlier this week, and now it's back kind of up to where it was before. So we still see us kind of in general going up a little bit. We haven't kind of turned the corner for that steady decline that we're all hoping starts sometime here in May. So just all of that, and keeping that in mind as we talk about what we're going to talk about. The other story we wanted to mention, because it's related to our topic today, which is what we call retention marketing, we'll get to that in a little bit, is a story that, at least the one we're referencing, came out yesterday from Health Leaders, and it talks about Teladoc. And it's based on their quarterly reporting in terms of revenue and earnings, but the information that really leapt out at us was the huge increase in terms of usage of their visits. So they showed a 92% increase in the first quarter in terms of overall visits of their tool. I mean, Chris, that's just a stunning increase.
No doubt. And I think, we've talked throughout this podcast, and I know in a lot of other, the thought leadership that we've shared, showing just the dramatic increases that have really made telehealth kind of the cat that's out of the bag, right? I think that's an interesting thing for our industry, and I think something that we'll have to continue to watch and monitor as we move forward, how that continues to morph and grow.
Yeah, and like we've talked about, we hope that this sticks, right? Because there was even though the value of virtual visits is pretty clear, pretty low adoption rate before this hit. We had physicians that were resistant, patients who didn't understand it. We've seen both awareness of virtual visits climb dramatically in the research we've done among consumers. We've heard about physicians embracing it because it's the only way they're able to connect with their patients. We've seen CMS drop obstacles in terms of reimbursement. So we hope that all of this stays and we don't revert. And I would think that the thing that probably will most impact that dynamic is the reimbursement. If that continues to be something that isn't a challenge for providers, I would imagine they would continue wanting to use this tool. Wouldn't you think?
Yeah, absolutely. And I think, your point also draws something important to remember. The largest healthcare utilizers, folks, 60 and above are still lagging in adoption, right? I mean, they're coming along with the rest of the country, but when offered a choice, will those healthcare utilizers, even for the things that telehealth is probably most appropriate for, not just being pushed to use in times of a pandemic, will they continue to or will they embrace it?
Yeah. Yep. So something we'll keep an eye on as we move through this and hopefully out of this. Remains to be seen whether we will really move out of this in any significant way, but we're all hoping for that. The other thing we want to hit before we dive into the main content for today is just a reminder again to go to our communications hub at thinkrevivehealth.com/COVID-19. You will find our latest research there. You will find the opportunity to sign up for or even read past roundups that we send out on a biweekly basis that is full of advice. And then we also have added a lot of content around what we call rapid recovery, which is how hospitals and health systems need to really focus on moving out of COVID and back to normalcy in terms of volumes, given the huge financial hits they've been taking because of the pausing of elective procedures, which is really a misnomer. It makes it seem like people have a choice whether they're going to have that procedure or not. And the vast majority of those are really not elective. I think somewhere we found a definition that elective simply means scheduled. So as opposed to an emergent surgery from a trauma like a car accident or a heart attack, anything that can be scheduled has been put on pause. So maybe we need a different definition for that. But that really relates to what we're here to talk about, Chris, and that is this idea of retention marketing. And it's so fascinating to me because I would venture to guess this is the first time in the history of hospital or health system marketing that we've had to pay attention to what we're calling retention marketing. And what we mean by that is patient retention, not patient loyalty, because that should have always been a strategy that the hospitals and health systems follow, though most didn't prioritize that maybe as much as they should have. What we mean by patient retention is you had patients who were scheduled, like we just talked about, for procedures. And because of COVID-19, hospitals and health systems were forced to turn off all of these non-COVID related or non-emergent related services So all of those folks basically were either postponed or canceled in terms of the procedures. And now that we're opening things back up, there might have been an assumption that, well, those people will just slot back into their schedules. And we're going to talk today about why that's not the case and why we have to have a strategy to really retain those patients. And that's what's new. We've never had to, from a marketing or maybe even communication standpoint, worry about retaining patients. Once they were scheduled for surgery, we pretty much were assured they were coming in. Certainly things could happen. People would have to reschedule, but almost always that was a small minority of patients that was handled by the clinical side, by operations. Now we're looking at this in terms of a really critical thing we have to focus on if we want to recover financially the way we need to. So first, Chris, let's kind of just talk about at a high level things that we're seeing and things that we think about in terms of success when it comes to patient retention.
Yeah, so I think, Chris, it's an interesting point that hospitals haven't had to think about this before. And I've given a lot of thought to that because coming from a direct-to-consumer marketing background, where you are really focused on what it costs to acquire a consumer and what it costs to lose and attract new consumers, there's a much more dedicated emphasis on retention. And I think in hospitals, we've been so focused on higher level brand awareness communications. Even some of our patient-focused marketing has been more about awareness. Once we get them into an appointment, we leave it up to the clinic folks for the most part to maintain those relationships and communications. I think it's not complex. The good principles of retention marketing are the same as they are for acquisition marketing, right? It's about really kind of understanding who those customers are, what their needs are, and kind of how best to tailor that and communicate with them. And I think just because we haven't played in this space before, we certainly have an opportunity to step up and play in that space by coming alongside of our clinicians and our physicians and our service line leads that are really kind of driving that effort.
Yeah, we're gonna talk about some specific ways to do that, but I think it's fair to say, Chris, in the work we've done with clients, in talking to some of the systems that are out there, the idea of patient retention may be new to even the people we're talking to, but folks quickly understand the need for it.
Yeah.
But the danger of not managing this the right way, we're really seeing, unfortunately, and I think there's good reason for it, kind of, a decentralized approach to this. So it's, the way I put it before is, it's kind of like 1,000 tails wagging the dog. So essentially it's all the different, people out there, physicians, clinicians, unit leaders, service line leaders that are driving this, and it's not being managed from a centralized place. Is that fair?
That is fair to say. And I think, the risk of an uncoordinated approach is that you'll have success in some places and maybe not so much success in the others, really dependent upon the individual methods that were used.
Yeah. And the first reason we would say you would want to have a centralized approach is because this isn't something where in most systems, anybody should be marketing because they want to. You are opening your doors. Somebody said this yesterday, and I love it. I'm not going to use their name because they may not want me to use it. I would give them credit for it. It's not my statement. We're not flipping a light switch on here where everything turns on. We've got a dimmer switch, and it's going to go on slowly, meaning your doors, your services are going to open slowly and not all at the same time and not consistently. Yeah. And so if you're letting all the different units or physicians or service lines just basically drive patient retention on their own, that means they're likely not going to be aligned with the prioritization of what you need to be doing in terms of patient acuity, in terms of operational readiness, and in terms of profitability, because you need to consider all three of those and have an organizational approach to all three of those, right?
Yeah, absolutely. I mean, it's no different than how we would look at segmented marketing, right? It's about knowing who your audience is, identifying how best to kind of reach them, communicate with them, even the level of investment that you want to put into different segments and the types of patients that you want to make sure that you're reaching first and putting that effort into as your dimmer switch is being turned up.
Yeah, and I think what we're seeing is, because this is happening very rapidly in many of the markets, like Ohio, for example, they're open. Pennsylvania, they can be open. Let's put it that way. A number of states, right? So it's a real scramble because folks
Yes.
are having to just switch from COVID focus and still dealing with COVID, right? That hasn't gone away, to reopening. And I think a lot of what we're seeing is because the energy exists out in the organization, right? You got physicians that have been sitting on their hands for the most part, or
Yes.
raring to go, and understandably so. And because this is not something, to the point earlier, that marketing has ever done before or been
Yeah.
involved in, there almost seems to be a like, well, that's out of our control, or we're not going to go there because we don't have time, or we're not invited in. And we would just really, I think, strongly advocate that marketers, to whatever degree they can, really help guide this, right?
Absolutely, because the thing that we bring to the table is understanding the consumer lens. I mean, our clinicians, our service lines, of course, they want to serve patients and serve them well, but the focus is going to be on what the needs of the organization are, right? And I think we can really step up and we can help them understand that consumer lens, what they need to hear, how we need to say it. And I think that is probably the most important place, or the first place, I should say, that we can really help in earning that seat at the table and kind of leading and coming alongside of our operations folks and clinicians by providing that framework for messaging and staging that. Because again, we're not just thinking about patients and families. I mean, certainly for patient retention we are, but those are the same messages that will also be making it out in the community. So the more that we have a consistent approach across the organization and a messaging framework and how we're turning up our business, the better off it's just going to be for the organization as a whole. And we can play that role.
Yeah. So messaging guidance is huge. Like, we've talked a lot of this podcast about the research we've seen and reluctance to come back in. And there may be a lot of folks out in the organization who don't realize that's the case, who aren't privy to that research, and who may just assume, hey, all I got to do is send a letter to these folks and say, okay, you're back on the schedule, right? And so that messaging leadership, really important to help guide that. What are some of the other things that we're working on with clients in terms of patient retention that are important?
Well, I think it's, again, supporting the relationships with clinicians. So, I think from all of the research that we come across in the industry, consumers trust their physician more than they trust hospitals, right? So getting them back into our pipeline is all about continuing to build that trust with their physicians. So it's about, how do we help physicians engage consumers, not just in telling them when they're coming back, but can we develop kind of cooperative programs with them where we're helping to reach out to patients to engage them on how to manage symptoms while they're holed up waiting for their procedure, or concerns that they or their caregivers might have. It's not just about letting them sit and then telling them, hey, you're in the queue, come on back in, it's safe now. It's about kind of building that relationship during that hold period, building that comfort and addressing some of those things as you are getting ready to get back in the game.
Yeah, and that it's such an important part of patient retention because, again, we're not opening all of our services immediately, comprehensively. Even if we were, right, we wouldn't be able to handle all of the patients that were backlogged, because you're really talking about three cohorts. You're talking about the people who from March through April were scheduled and had to be postponed. So they had needs before all this started that were identified, and it just happened to slot into that 6 to 8 week period. Then you have people who during this period are identified as needing care, needing procedures. So they're going to have to be fit in. And then you have the people moving forward who are going to identify with needing these procedures. And you're also going to have to slot in. So the point of all that is, even if we were able to open everything up, we're not going to be able to probably handle all of the people. And we're not able to open everything up at the same time. So that means there will be a queue. You mentioned, people are going to be in the queue. So some people, based as much on readiness and acuity, are going to be pushed again further down the line, which gets to this idea of nurturing.
Yes, absolutely. And, I think, you made the point earlier, Chris, about to the extent that we can kind of have a coordinated program. I think we've tended in hospital marketing to have nurture programs that exist outside of perhaps what's happening with the clinical relationship that a person might have. And I think in this time where we have clinicians or physicians reaching out to patients in a standalone nurture program, while we're trying to be helpful, the potential for that to be confusing or tone deaf exists. So I think that's why it's important to say we can assist in nurturing, but the best way to do that is to really understand how we are already reaching out to patients and what might be happening on the clinical side and coming alongside of them. So even if we don't have one overall umbrella coordinated program, we're piecing it together smartly and with knowledge of what each is doing, right?
Yeah, exactly. And I think the point of all this is if we're doing the things that we did before all of this, which is essentially, and we've talked about this on the podcast, somebody is identified as need, let's say for hip surgery. So they're given instruction on how to schedule, they're given instructions for what to do to prep for the surgery at the time of scheduling. Maybe a week before, if you're doing this the right way, there's a reminder that comes from the portal or otherwise that says, hey, now this is when you start your diet. This is when you start doing whatever. So basically there's kind of two touch points, the scheduling and the kind of dissemination of patient education, and then hopefully a follow-up, though that's not always there either.
Yeah.
If we're relying just on that kind of basic communications in this situation, we're going to be missing the boat. We're going to have people that are potentially drawn to other systems who are more proactive, who do nurture better. And so really important as much as possible that we are creating a consistent communication stream. One of the ways we can do that is what we talked about at the top of the show, which is virtual visits and telehealth, right?
Absolutely. And I think, you know, the cool part of how telehealth has come out in this whole pandemic is that it hasn't just been a reactive mode entirely. So in other words, I'm a patient, I have a need, I therefore schedule an appointment with you. We have examples of systems and clients who are using telehealth to check in with their patients and to offer that reassurance. And it doesn't just have to be clinicians or physicians. It could be other clinicians or members of the care team. And, you know, thinking about how to use telehealth, particularly with higher acuity patients, even if it's just checking in, you know, I think is important. It's that proactive engagement. And we've seen, you know, even news reports in the general consumer broadcast media talking about how patients are using telehealth to stay in touch with their providers and while they're holding up and waiting for surgery. So don't forget about it. It's not just a clinical appointment. It can be an engagement tool.
Right. And what we're talking about here is essentially customer service. So we're not talking about a reimbursable event. We're talking about customer service where you would proactively reach out to patients. Again, whether that's just to confirm that they've got what they need for the procedure, to check in and say, hey, you know, we realize we can't get you in for a month because of, you know, the prioritization, and we have to put patients who are more emergent before you. But is there anything we can do for you now? Is there any information? Is there, you know, any questions we can answer? There's just such a huge opportunity if you can kind of wrangle that technology and coordinate it the right way. So anything else, Chris, before we wrap that you think is important for folks to think about in terms of patient retention?
You know, just one other thing when it comes to health, don't forget about caregivers, because right now, I mean, we always know that caregivers have some level of influence over patients' decisions. And in this time where there's fear, and for that bucket of consumers who may be scared to come in, caregivers are a big influence. So I think it's about how can you also make sure that you're communicating with caregivers. Telehealth may be a way to that as well, particularly for some higher acuity patients. But I think, you know, the last thing I would just say is just around execution concerns. I think because we haven't played in this space, we may be saying, how can we help? And I guess I would just, you know, as I was in the shoes on the health plan side, sometimes you don't have perfect systems. You need to piece things together, right? And so how can you work as part of your operations, clinical, you know, team with physicians? You have access to marketing automation tools. You have access to a variety of things. Are there things that you can kind of use in a skunkworks way rather than, you know, a connected system way? Just think outside of the box and how you can support some of the effort, I guess.
Yeah, and I think we definitely see that because it starts to become very overwhelming when you think about how are we going to have a consistent, effective program across all of our different service lines and sites and physicians.
Right.
But the flip side of that is this is a little bit of a one-time shot. This is not something that you have to set up that's going to be used permanently.
Right.
Once we get through this, there won't be such a need for patient retention at the level we're talking about. It's basically because we're starting at scratch.
Right.
And we have to rebuild those volumes. We have to keep the patients that we intended to see. And once we get things back on a normal kind of pace, we can kind of dismantle a lot of that effort. So it doesn't need to be something that is built to last forever,
Right.
because you won't have the need forever. And that maybe will help folks take that kind of skunk works approach. And also feel free to kind of do things patchwork as best they can just to get us through this rapid recovery period.
Absolutely. Absolutely.
Awesome. Well, Chris, thank you so much for joining us. That was fantastic.
Yeah. Thank you. Glad to be here.
Yeah, for sure. Chase, as always, sir. Where'd he go?
There we go.
Oh, wow.
The mute button. Of course, enjoyed it.
I thought you're waiting for me to finish my sentence. There was a dot there.
Dot there.
You couldn't see. Hey, if there's something you want us to cover that we're not covering, let us know that. You can post something in the chat tool right now. You can always email me at cab@thinkrevivehealth.com. Tomorrow, we're joined by Revive Health's Matt Gully, who's going to give us a sneak peek into our special COVID-19 communications report that goes out on Saturday. That's a great resource. If you're not signed up for that, you definitely need to be. And I think that'll be great for Matt to kind of walk through what we've got coming up. And also Jeff Spear will be sitting in as guest host for me tomorrow. So thank you, Jeff. And I know he's done that in the past. So folks can look forward to having him back. Remember to visit thinkrevivehealth.com/COVID-19 for a recording of today's episode and all that content we talked about before. Subscribe on iTunes, pass along this podcast to anybody you think would benefit. And like we say every time, all of you out there, marketing communicators, the hospital and health system space, what you're doing is so critical. Communications is so important to the health of your organization, to the health of your patients, and to all of us as we try to get through this pandemic. So keep it up. We know it's a really tough time. We know a lot of you are dealing with furloughs, layoffs. It's not an easy time for marketing and communication departments out there, but keep doing what you're doing. And we will be here with you every weekday until this all passes. So thanks so much for joining us today, and we'll talk to you tomorrow.